Hi, I'm Dr. Andreo Spina, and we're here at the Onnit Academy in Austin, Texas. I'm here with Cameron, and we're just going to demonstrate a basic hip opening sequence that you can use to train your hips to maintain their health, as well as to warm them up before you're doing anything like big lifts, squatting, deadlifting, or anything like that. So what we're going to do, facing this way, we're going to get into what we call the 90-90 position. So what I'm going to ask Cameron to do is, if we're facing this way, I want the lead leg to be directly in front of you and bent to 90, lining up with the heel on the same foot. And then I want the trail leg directly to the side of us, also bent to 90, lining up with the heel on the back leg. So first thing we're going to do is we're going to work the front hip into external rotation. So from here, I'm going to ask you to extend your back, almost trying to get your belly button to hover over your knee. And then from that position, if you lean forward, keeping your chest up high, you're going to feel a very deep-seated, deep stretch on that lead leg. What we're stretching here is actually the gluteus minimus muscle, which is also stretching into the hip capsule, which is really what we want to target with this 90-90 sequence. So from here, we're stretching forward, we're getting that deep stretch in that lead leg. From the same position, we can work on the trail leg. Of course, the trail leg, we're going to work it into an internal rotation position. So if I get you to put your hands on your chest, the idea here is to try to square yourself off with that trail leg. If you can't square yourself off, you can always post out behind you and you can kind of walk yourself into that position. This stretch is going to be a little bit less comfortable than the lead leg. This stretch is a very deep-rooted stretch for the hip capsule, but it's also a very good indicator of hip health. If you can't get into this position, if you have any pinching pain while you're getting into this position, that would tell you that you probably want to get your hip looked at by a professional to make sure there's nothing intrinsically wrong. So from this position, we can hold that passive stretch here. After you've held that stretch for a good amount of time, then we can work on a transition from this position. So from here, the idea is to keep all of your weight on the back leg. Now I'm going to ask Cameron to post up on the toe, and then what we're going to do is we're going to swing that leg open, and we're going to keep the lead leg down as long as we can. We're going to open it up as hard as we possibly can, trying to drive that back leg towards the floor. Now we can go back, point your toes down, bring that hip back into internal rotation. So from here, we can do some reps of hinging this posterior leg. So let's go for a few reps now. I'm going to post that down, open up that hip, keep that lead leg low and on the ground, and from here we're contracting our glutes on the opposite side. Try to pull that leg down as far as we can, bring it back in and reset. After you've done a few reps of that hinge, we're going to go ahead and do what we call a 90-90 transfer. So we're going to end up in the same position on the opposite side. So once again, we're going to open up this trail leg, and then from here we're going to end up in what we call a bear sit position. In the bear sit position, you can spend a little bit of time activating your glutes, trying to get those knees all the way down to the ground, pushing down as hard as you can. When you've had about enough of that, then we're going to pivot on the opposite leg, and we're going to close down this hip, and you notice now we end up on the opposite side 90-90, where we can go ahead and stretch that lead leg, or we can post back and stretch that posterior leg.